My name is Jessica, and I'm a massage therapist at ABW in Grapevine, Texas. Fascia. Let's talk about it. I recently watched a documentary called The Mysterious World Under the Skin, which was produced in 2017 by ZDF, which is a German news company that is independently run and is a nonprofit institution. And it was then presented in English by another German news site called DW in 2018. So, in this documentary, they talked about fascia being about 20% of our body weight, and depending on the individual and various circumstances, that the fascia would be up to 70% water. Now, this fascia has long been thought to be in inert tissue, like it had no contractile properties the way that the muscle has a contractile property. But the recent studies that they've done, and from the various professionals talking about this in the documentary, it actually is a contractile tissue. There is a rate of tension that is dynamically monitored by the body, and adjustments are made within the fascia. And it had some really interesting implications with acupuncture. One of the experts either had training in acupuncture or was studying acupuncture and was trying to measure the amount of resistance when a needle was removed from someone's skin, because apparently in acupuncture, I've never poked people with needles, so I don't know, but they can feel resistance from the soft tissue as they're trying to remove the needle. So they were able to measure the amount of force needed to remove the needle, and they found that there was a difference, that there was a relaxing effect on fascia from these acupuncture needles up to several centimeters away, which in the grand scheme of things, I don't know if that's like something happening in Texas affecting Pennsylvania, or something happening in Grapevine affecting, Laredo, Texas. I don't know how big is that distance physiologically or anatomically speaking. But the woman talking about it, I think her name was Helen, was very fascinated by that. So apparently it's a pretty significant distance for an acupuncture needle to affect something so far away. Now, something that you've probably heard TC talk about in the medical massage practitioner program classes is meat versus rice. So meat is movement, exercise, analgesic, and treatment, and rice is rest, ice, compression, elevation. Two opposing views on how to treat injury and how to go through injury rehab. So in meat, it's essentially that you want to start movement and treatment as soon as possible, whereas rice says, stop everything, don't move it, ice it, put some compression to control inflammation. And I believe that there's an appropriate time to use both of these methods. So I'm not saying that, rice is all bad and that you should use meat every single time in every single situation. But according to this research in fascia, it lends credence to the theory of meat in a lot of situations. So specifically talking about someone who gets their arm put in a cast. They found that after 3 weeks of having their arm in a cast, there was significant matting in the fascial tissue. And I wish I had the ability to put it on screen for you right now so that you could see it. But for now, just getting this little info snack podcast series off of the ground. I'm keeping it really simple. I don't have a lot of time to edit these videos just yet, but I do encourage you to look up this documentary. It's about 42 minutes long, but the pictures that you see in it are mind-blowing. So I highly, highly recommend that you look this up to see it for yourself. I will link it in the comments below or the description, or whatever. It'll be available. So. But that when they did an animal study, they did a mild injury. I don't know, they weren't specific about what that meant, but in their experimental animals, and they would randomize if they were going to stretch the animal after this injury or not. And so they found that the animals that had stretching twice a day after the onset of an injury had better healing and less inflammation than the ones that did not. So really strong evidence to support meat. Now, in conjunction with that, back pain, one of the most common, non-specific back pain, I believe is the correct terminology that I've heard. So this is something that's not explained by degenerative disc disease or MS or any other myriad fibromyalgia of diagnosable conditions. It's the kind where you take an x-ray and nothing appears to be wrong, but they say that they've got back pain. So they found that in the cases of healthy fascia, that the fascia should be able to stretch about 75% of the length of its fibers, but that in people that had back pain, the fascia was only stretching about 50%. So it had less slide and glide, which was a common factor for people complaining about this non-specific back pain that was not explained from other variables. So really interesting. It lends a lot of credence to regular stretching and exercise. It's no longer a like, well, we feel that it's good for you and you should do it, or there's some level that's appropriate for the individual, but now there is scientific evidence linking regular exercise and stretching to promote the health of fascia, which could help break that chronic pain cycle of non-specific low back pain. So amazing. Now on that topic, well, what about massage? Isn't that good for the fascia as well? Yes, of course. So also within this documentary, they talked about hyaluronic acid, which is one of the things that helps to lubricate the fascia. But when the fascia becomes really matted down, it's not able to get the same amount of moisture and nutrients that it usually would in order to slide and glide the way that it should in its healthy state. So they found that very, very deep, slow manipulation of the soft tissue was essentially like taking a kitchen sponge and trying to squeeze out every possible molecule of moisture, just squeeze. And that after they released that pressure, that it could even be more hydrated than it was before. Because if it doesn't have that hyaluronic acid, the fascia essentially becomes like terry cloth rubbing up against itself, which in my mind, my question that rises up when I learn this is, what about the nerves and blood vessels and lymph nodes or lymphatic tubing? Could that be affected by this terry cloth like friction that's happening between matted, dehydrated fascia? So that's my own personal pondering on that note of the terry cloth and lack of hyaluronic acid, but I found that really interesting. Now, I mentioned fascia being a contractile tissue, so there was one guy that took fascia, strands of fascia or some fascial tissue, isolated it and put it into some kind of jar that he was able to then add, what did he call it? Added messenger substances. So he said that fascia will contract in response to these added messenger substances. He didn't specify what they were, but that it would contract independent from nerves and muscles. So this messenger that it detects, it will then react to that and it will adapt its tension accordingly. On top of that, because of this chemical, well, I don't know if it was that chemical. They did mention one specific, TGF, I think they called it, was a chemical that would affect the tension of fascia in relation to inflammation and emotional stress. I'm sure many of us, myself included, I've heard clients come in saying like, oh, when I'm really stressed out, my neck pain gets worse or my back pain gets worse. Different conditions that maybe they're usually at a 2 or 3 pain level on the daily, but then if it becomes high stress type time or situation, it can be between like a 5 and a 7. So this is evidence to link emotional distress or emotional stress and inflammation to fascial tension, which can be related to pain. So really, really interesting stuff. Like I said, I highly encourage you to go watch the documentary yourself. If you happen to have read something about fascia recently or seen another documentary or what have you about fascia that have expanded on any of these things that I mentioned, or if there was something, is there something else about fascia that you know that I didn't mention here but you think is relevant to what I'm talking about now, I would love to hear it. Please share your thoughts and opinions. All I ask is that if you're going to give some information like, fascia is whatever. Fascia is something, or fascia doesn't this. They did further studies and they found, XYZ. All I ask is that you link your sources. So if you want to provide additional information, even if the source is, I heard it over the years, but I can't think of anyone specific, that's okay. That's okay. Go ahead and post it. Just let us know. Just say, that you don't know where it came from, but you just heard it over the years. I think in this day and age, we're very quick to discount information without thoroughly sifting through where it came from. So please feel free to give your thoughts and opinions. Just be transparent about what informs those thoughts and opinions. Similarly to how I did at the beginning of the video. I didn't do a super deep dive into the production of this documentary, but if any of you wanted to look up this documentary, you could, and I am going to link it, but the YouTube video is not from ZDF or DW. It's like someone's personal channel, I think. Those random ones that have a name that are like a name and like a 56 or an 01, and you're like, who is this? But the documentary is there, and there is a list of credits in the documentary. So if you want to do a deeper dive on who produced this documentary and who was involved in the making of, by all means, do that deep dive. I didn't notice anything that was like a red flag, but I think that there can be really good investigative journalism, I guess, if we think about where something comes from and who funded it and who stands to benefit from this research. And certainly we as massage therapists with this information now have scientific evidence to link a deep tissue massage, getting that regularly done as part of someone's self-care regimen for keeping healthy fascia and trying to stay out of pain just from that aspect. So I would love to hear your thoughts. If there's other topics that you want me to cover, or if you just want to hear more about fascia, let me know. For now, like I said, I'm planning on this being something weekly, something pretty simple, the info snack, if you will, something you can boot up and listen to on your way to work or while you're doing some chores at the house. I just highly encourage everyone to always keep learning, always be bringing in new information, something to chew on. And as a group together, when we bring together this information and when we thoughtfully, peaceably discuss these, tidbits of information, we can really get a nice, bigger picture on the truth and what areas would be beneficial to explore next based off of the information we currently have. So that's all from me. I hope you have a wonderful day. And if you're not currently a member of the ABW EDU community website, please do consider buying that subscription. There's a lot of technique videos, and we also have a monthly MMP Zoom, MMP for medical massage practitioner. So if you do pay for the subscription, then you get access to even more really great content. So I always encourage that. But in any case, I'll see you later.